Hello and welcome to Docplexus News. Let's discuss this week's healthcare headlines that matter. A strike demanding 50% reservation in postgraduate medical seats for in-service doctors was held on 5th March by the government doctors. This strike was a protest against the MCI seeking amendment to the council's regulations. According to the association, 50% seats reserved for in-service doctors strengthen the rural health services. Health Ministry has recently disapproved proposals of 140 medical colleges to start or increase PG seats for the academic session 2018-19 after considering the MCI recommendations. The MCI team had visited these medical colleges and found that the facilities were not up to their norms to increase PG seats. Recently, the National Pharmaceutical Pricing Authority analyzed profit margins on syringes and needles. It was observed that inflated MRPs ensured the trade margin for the distributors crossed 1200%. The average profit margin on syringes was found to be 500%. The Medical Technology Association of India said the government must cap overall trade margins and let the market decide how it is shared. The AIIMS doctors have used a new delivery system for treating abdominal cancers. The technology, known as hypothermic intraperitoneal chemotherapy, involves administration of heated chemotherapy drugs into the abdomen during surgery. This delivery system leads to improved survival rates due to delivery of higher dosage of drugs at targeted sites. The scientists at New York University School of Medicine have developed a new tool that can identify patients who are at high risk of post-surgery implant dislocation for hip replacement. The study findings demonstrated a 6-fold decrease in the rate of dislocation in patients who underwent a total hip replacement using this algorithm. The government is going to reconsider unrelated organ donation fees if it is causing any trouble to the recipients. This decision was taken to curb the unethical practices related to organ donation. As per new orders, recipient in an unrelated live donation should pay Rs 2 lakh to the government network of organ sharing and Rs 1.5 lakh to the donor to take care of his post-donation treatment and health needs. The centre has informed the Supreme Court that Aadhaar is not mandatory to appear for NEET examination. The centre stated that UIDAI, which is responsible for Aadhaar issuance, has not authorized CBSE to insist that NEET applicants to have Aadhaar number. CBSE has recently released instructions for open school NEET aspirants. The CBSE has asked the NIOS students to submit the name of school, college, year of passing, place of study and the state and district where the school or college is located. Even after High Court's order to allow them to fill online application, many candidates face technical glitches. This matter is listed for hearing in April. To help the families and to encourage the swap kidney transplant program in the country, Dr. Priyadarshi Ranjan, head of Comprehensive Kidney Transplant Center at Fortis Mohali, India, has launched the iKidney app. Patients can easily register on this free app. The data is matched to hundreds of already registered patients and thus they can be perfectly matched with a family for a swap kidney transplant. This app is likely to help thousands of patients with kidney failure across the country who have legitimate donor within the family but are unable to get successful transplant either due to blood group or tissue incompatibility between the donor and the recipient. Our community appreciates Dr. Priyadarshi's innovative idea and congratulates him. Please share your views on this innovative new app by commenting below. These were the latest happenings in the medical field brought to you by Docplexus, India's largest online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!